The social media is like a very strong reason for depression nowadays among teenagers. They have like a proper body, the skin is more like clearer. They don't understand it might be photoshopped.
She goes home and she says to her husband that,
My therapist told me.
brother Kushal said that I need to get divorced and you're a bad, you're a bad human.
The main reason why children, they don't feel comfortable talking with their parents is because whenever they share something, the parents blame them.
There was a study conducted in NIMH, and they said that it requires on an average 10 years for someone who's suffering from a mental disorder to, first come to a therapist or a psychiatrist.
You cannot hide or lie to your therapist because then we won't be able to help you. You have to be very open.
Do you think someone should take children if they have a very traumatic relationship themselves?
Heal yourself and heal your relationship. If you think that you are the reason why this marriage is not working, then work on yourself, work on the mistakes that you have made.
So Afifa, a 17-year-old teenager, comes to you, you're a psychologist, and in her first session, she starts crying a lot and she tells you that she sees no point, in living. Her parents are very, abusive and toxic. Lots of trauma in the past. And she's just there asking you to help her commit suicide. She's asking for pills, I would say. So what would be your first words towards that 17-year-old girl?
First, I'm gonna tell her that it's a safe space. So everything will be confidential between us and she can speak her mind freely without any fear of judgment or without any fear at all. She can be herself and she can express her trauma, her pain or whatever bad experiences she has been through. After that, I'm gonna point out to her that, this life is really beautiful and there will be ups and downs. And sometimes we confront a lot of bad things in front of us, but we have to stay strong. We cannot be weak. And I'm going to tell her that she's still so young. She has her whole life ahead of her. So I would ask her to calm down a little bit. My main priority will be to calm her down because she's on the verge of committing suicide. And she has already thought about it and has a plan that she wants to do it with pills. That means she's quite certain about it. So my main concern would be to calm her down and to get rid of that idea from her head. And if I can convince her to see life worth living again, maybe then at the heat of that moment, she's just making a decision. She's just being impulsive. She's in so much pain. She just wants to end it because she doesn't want to feel it. But the fact that she came to me, that means that she still wants to be okay. Otherwise, she would have done it already. She wouldn't come to me or anything. That means in deep down, she wants to be okay. She just wants a helping hand, to guide her. And I want to be that helping hand. I want to tell her that, I want to help her to heal from her trauma and to see life beautiful again. So that's what I'm going to tell her.
That's beautiful. Sometimes a few clients come and they just don't want to hear any kind of suggestions in the first session. So we just need to give her, sufficient amount of time. Maybe it's for 1 session or 2 session or 3 session. And after she has, spoken about everything, then, we can plan for a beneficial future. So you work with a lot of, teenage clients. What are the common things in teenagers that you see that leads them to depression nowadays?
Okay, so nowadays teenagers, they mainly have this issue. The relationship issues is quite high. So they get too attached with someone proper, they get too attached, and then what happens, at one point they get trauma bonded because whenever they're getting that love in the beginning, they're love bombed. And after that, they get too attached. And even though when they know that this person is not right for me, they're still attached. They can't walk out of that relationship, which adds pain to their life. And also I would say that social media is a very strong reason for depression nowadays among teenagers, because teenagers, they use social media, everything, whether it's Instagram, Facebook, Facebook, and there's so many different kind of apps nowadays. So they use it and they compare their lives with other people, not just based on relationship, but everything else, like the lifestyle, or like, they're seeing their friends having a kind of life, or they're seeing other people like, getting this, going there, and they compare themselves with that lifestyle or with them. Like, sometimes it can be about body figure. Like, they see like, people in Instagram, they're like, like they have like a proper body, maybe figure, and they're more like the skin is more like clearer, and they don't understand it's like it might be photoshopped. It might be like they might have used filter or something, but they think like, okay, she has like, such a good figure, why don't I have it? So this can cause like insecurities in them as well. So I would say relationships, social media, and also like, family conflicts, because nowadays marriage don't last that much. So a lot of people do get divorced, and children, they suffer a lot when they see their parents getting like, separated, or when they see their parents constantly fighting. So it definitely affects them. And they actually like, go through that trauma. So these, I would say these are the main issues nowadays.
Great. So, as you talked about marriage, do you think someone should take children if they have a very traumatic relationship themselves, like husband and wife fighting every day, or they're in a conflict and they don't know if they're going to, be together for the next 5 years, and suddenly they plan for a child, and that child comes to the world. He always sees these fights and conflicts. It affects them a lot. So what would your suggestion to be to parents if they want a child, before having a child? How can, they improve their relationship? Or what are the prerequisites they need to think about before having a child?
Okay. So bringing a child to this world is a huge responsibility. You just don't become a parent by giving a birth to a child, right? You have to be there for them. You have to be emotionally available for them. You have to provide a good environment for them where they can develop, where their mind can develop. And whenever you are not being able to be there for them, or if they're exposed to this kind of fights and violence, it's definitely going to affect them. So my suggestion would be that first, heal yourself and heal your relationship. If you think that you are the reason why this marriage is not working, then work on yourself, work on the mistakes that you have made. And if you think that you are not being able to adjust with each other, but you still want to make it work, then I would suggest that seek therapy, go to counseling therapy, relationship counseling therapy, and then, understand like why these problems are happening and how can you fix it, since you guys still want to be with each other. And if not, if you think that it's not possible at all after talking to the therapist, if you think that there's no way you can adjust, you can accept, then okay, fine, split your ways. In that way, you are doing that child a favor. And if you think that okay, fine, we can make it work by seeking therapy long term, obviously whenever there is a crack in a relationship, it takes time to heal. It will not be done within a day or two. You have to be consistent, you have to put effort, you have to come to your therapist regularly, and whatever they're asking you to do, the homework they give you, you have to do that as well. So after that, a lot of people, obviously, I know a lot of cases where they were on the verge of leaving each other, but after seeking therapy for months, now they're happy. So once you reach that level where you know that okay, we can adjust, we can respect each other's boundaries, and we can be with each other without causing harm to ourselves and others, then maybe you can think about family planning.
Sometimes these children also come to the therapy and they say that my parents are always fighting, and although they love me, but they're always, making a chaos inside the family. So what I, as a psychiatrist, always try to tell them with a lot of empathy, definitely, because it's tough for them, is that you should always determine the relationship of your parents the way that they are treating you. Like your dad might be treating your mom in a negative way, but your dad might be loving towards you. So it's helpful for you to respect that relationship, because in our lives, not all relationships are stable. Like your dad might love you, your mom might not understand you that much, or your dad and mom both can be a bit toxic, but maybe you'll have a grandmother who will love you and care for you, or an uncle who will love you or care for you. Maybe your boyfriend or partner will not understand you, but you'll have friends who will comfort you. So in our world, in this very complicated and tough world, it's always helpful for us to focus on the good things that we get from life, because none of us are immune to breakups or divorce or any kind of traumas. So to the kids, teenagers, or anyone who's listening to this, I always tell them this, that always focus on your one-to-one relationship with your parents. Yes. There might be lots of reasons why your parents are fighting. You don't know their story, right? But if she is loving towards you, if she cares about you, if she's doing what she needs to do, then you should try to accommodate her in your life, because that's the only option that you have. So Afifa, you also see a lot of cases where people don't take depression seriously. So how can we define depression, or I would say, how do we understand that sadness has converted into clinical depression? What are the signs or symptoms?
So depression has some common signs. I would specify them. First, it's not just about having like a bad mood. It's about a lot of things, like you are not going to have interest in, like zero to little interest to nothing, to things that you actually enjoyed before. Suddenly you don't have interest in that anymore, whether it's like maybe the extrovert people will become introvert all of a sudden, or someone who loved going out, spending most of the time in the room, isolated from everyone. So these are the common signs we see. And then also changes in appetite. Some people, they eat a lot to fill the emptiness, the void. And then some people, they cannot eat because their taste bud and everything changes. And then the sleeping pattern also gets disrupted. Some people sleep a lot, more than necessary, more than 8 hours. They're sleeping, they're waking up and then sleeping. That's because they want to escape the reality. They want to escape the pain. And some people, they cannot sleep in depression because the thoughts keep them awake, intrusive thoughts. They overthink a lot, and the pain and everything, the anxiety, it keeps them awake at night. And then people, they become very indecisive sometimes. They know what's right for them or what's wrong for them, but still they're not being able to take a decision, or they can concentrate, whether it's at work, whether it's in relationships, whether it's in studies. They lose that focus. And what happens is most of the people, they start to feel very worthless. They feel like, oh, I'm not being productive, I'm not useful,
no one loves me.
Exactly, no one loves me. That's why this is happening to me. And
and I should be hated.
Yes, like this kind of thing. And when someone is in depression, even doing small tasks becomes very difficult, whether it's making a meal or making a bed or taking a shower. They feel so drained. They feel so exhausted all the time. They just want to lie down on the bed. They don't have the energy to do anything. So that makes them more depressed, that now I'm not doing anything. I'm not, like, my friends have job. My friends are doing this. My friends are working out, but I'm not being productive. I'm not doing anything. I'm not meeting. I'm not being sociable and all. So I think these things actually when they last for 2 weeks or more, that means you might have depression, and you should come and have a diagnosis or talk to a mental health professional. But if they don't last for that long, that means a lot of things happens in our life that can make us sad.
Yeah. Even a rainy day can make us gloomy.
Yeah, exactly.
Yeah, but it goes away, right?
Exactly.
So very well said. That I just would like to add a few points. When you have sadness, there must be a reason to feel sad. Like something will happen. Either you'll fail in something, or someone has said anything that you don't like, or anyone has died, or anything negative has happened in your life. But depression can happen without any kind of reasons, right? There is endogenous depression, and often what we do is, we kind of send implicit judgments to that person, like have patience, you just go out and just
Let it go, get over it.
Right. But these are implicit judgments. Sometimes we say religious things also, like like do a bit more prayers,
and you'll be fine.
And you'll be fine. But we don't say that to a person who's having a heart attack, or a person who's having diabetes. Definitely prayer can help, definitely it can help, but saying that to someone who's like having clinical depression is an implicit judgment, because we don't know that guy might be praying, that guy might have patience, right? And he might try a lot of things, but clinical depression is very, very different. And neuroscientists have said that there are visible brain changes in clinical depression, like the frontal lobe usually is found to be a bit small in patients who are suffering from clinical depression. The hippocampus volume also reduces. So there are changes in neurotransmitters, especially serotonin, norepinephrine, and dopamine. The circadian rhythm gets blunted, and there are also hormonal changes, like you will have high cortisol. You'll also have deregulated thyroid hormones. The REM sleep gets altered, and the slow waves of the sleep cycle also gets altered. So there are visible neuropsychiatric changes that happens inside your body, especially in your in your blood and your brain. So if we just label depression as your weakness or something like that, it's an implicit judgment we should, I think, never do. So can you tell us a bit more about how depression feels like, especially the sadness part of depression? Like, we all can feel sad, but what's the sadness in depression?
Like I said, like that sometimes depression can come with anxiety as well. So you're gonna feel like there is a tight knot in your chest. Then what happens is some difficulty in breathing. Sometimes you can have anxiety attacks. So then it is also like connected with depression. So you can have that overthinking, as I said. Then also you can
feel feeling
very empty, like feeling very lost. What am I gonna do with life? And then having recurring thoughts of suicide and self-harm. That is also very common when you actually, like, severe depression cases. What we see is that people often, like, they have thoughts of self-harming, and they do it as well because they feel like the pain is gonna get released. That's how they think. And then they also think about suicide more often. Like, some people, they don't really want to do it, but they don't actually have a plan that, okay, I'm gonna die today, but they keep on thinking, like, if I was dead, it would be better. I didn't have to deal with it. My pain wouldn't be there. So this kind of thoughts can also come.
A few people tell this to me a lot, that I absolutely can't feel happiness.
Yeah.
Right? That's the sadness of the depression. Sometimes we remain sad about something, but the total inability to feel happiness is what's the hallmark of clinical depression. So what are the things a person who comes to a therapist or a psychiatrist needs to remember before starting the treatment? Suppose if I'm suffering from depression and you're a therapist, you're a psychologist, so what will I keep in my mind before coming to you?
First is, like, you cannot hide or lie to your therapist. That's the first thing, because then we won't be able to help you. You have to be very open and take your time. There is no rush. You don't have to, like, if you don't feel comfortable to say everything of your past or what you're feeling during the first session, it's fine. Take your time, but be honest. And then also you have to remember that it's a two-way thing. Okay, you will not we therapists, we don't perform any miracles. It will take some time. If you, like, most people who come, they think that within one session, like, give us tips and we'll be okay, give us medicines and we'll be okay. But it doesn't work like that, because when something so traumatic happens to you, obviously you are not going to heal within a day or two. Even, like, when our organs, something gets damaged, to heal that also needs a lot of time. So you have to keep that in mind, that if I'm going now, it's not like I'm going to be I'm not going to recover within a day or two, and she's not going to give me she or he is not going to give me any tips that's going to like change my life overnight. So I have to stay patient, and I have to also like put that effort to like make it work.
But what I tell a patient when he comes with depression is like the thing that you said, that truthful speaking redeems people. Like, just if you honestly tell about your trauma, struggles, it's like acknowledge it, right? Like, it's okay to have a chaotic life, a depressed life, a messed up life. We understand, the pain that you're going through. So just be honest about it. Don't try to be a superhero in front of your therapist or psychiatrist, because he's not your brother, sister, or life partner, or parents, or anyone. He or she, or we are trained, to listen to people and to listen with empathy and non-judgment. So truthful speaking is the first thing that we suggest. And then what we tell them is, okay, now we understand that you're having a very messed up, depressed, and chaotic life. But let's find the causes, right? You might have a traumatic past. You might be having an ongoing relationship problem, or your parents might be toxic, or you might be suffering from, an unhealed sexual abuse. Let's try to find the causes. And after you find the causes, you now know why you are living a chaotic life like this. So it's not probably your fault. So there are reasons behind your sadness and depression. So then, sometimes it takes one session, sometimes it takes 3 or 4 or 5 sessions. People, vary according to their personality. And after they have, expressed everything, and we now know the causes, then what we tell them is basically 2 things. The first one is, let's not play victim, because that's a thing that's problematic in therapy. A few clients come and they just don't want to, think anything positive. They're just blaming. We understand their pain. We understand their trauma. We have listened for, I think, 5 or 6 hours now. But then we politely, with a lot of empathy, would like to request them not to play, the victim, and to gradually plan for a beneficial future. That's the second part. So the first thing is, let's not play victim, because that's not helpful. Because if you're going to play victim, you'll get a few empathy or sympathy from a few people, but most people don't give a shit about your life, right? They're so busy about their own life. So for your own well-being, I'm here for you. I'm your doctor. I'm not going to judge you. I'm going to help you. But for your own well-being, to lead a good life, let's heal that trauma. Let's heal those, reasons that's causing your depression, and let's gradually plan for a beneficial future. Because that's what turns on the lights in your therapy session. That's what brings hope to the therapy sessions. So moving from this question, I would like to now ask you a question about, I would say, your studies in UK. Like, you have completed your bachelor's from Malaysia, and then you went to UK and you did your master's, right, from Queen Mary University of London. So why did you choose psychology as a subject? Like, how did it fascinate you?
Psychology, the subject always fascinated me, because I wanted to study about human mind and human behavior, why people do what they do, why they act the way. And then because I had always interest in that, and also I have seen some of my distant family members suffering, and it was years back, and at that time Bangladesh was not that developed in terms of mental health, and I used to think that if they got proper help, they would be better, because I saw them struggling with depression, with a lot of things, and they could have a very nice life ahead, but they were so crippled with those disorders that they couldn't. So that actually made me think that I want to do something about it, because there's so many doctors, whenever there's any physical problems, then they rush to the doctors, but someone is suffering from a mental issue for months, but they don't go. And it also, they don't understand that it also does something to you, to your life, to your daily normal function in life, and it also causes health issues as well, physical health issues. So then actually that's what made me going for bachelor's. And over there, in my bachelor's, I studied abnormal psychology, I studied cognitive psychology, and then personality and all different kind of personality. And that made me more interested that, okay, I want to be like, a clinical psychologist someday. And so that was the first step. And the second step was completing my master's, which I did.
Okay, great. So do you, what are your suggestions to teenagers who want to come to this field? Are you optimistic about,
Of course, mental health is a very good subject everywhere nowadays. It's everywhere now. People are getting more aware. They're promoting mental health awareness everywhere, all around the world. Before, like, it was a taboo and people didn't give it much like importance. But now, like, whether it's in Bangladesh, whether it's in UK or USA, Canada, in not just in mental health field, but even in corporate offices and all, they're also like, giving importance to their employees' mental health. So it's a very growing business as well for a lot of people. And I would suggest that we need more therapists, more psychologists, more psychiatrists, because a lot of people, 90% of the people, they suffer from some mental health issue, whether it's mild, whether it's severe, whether it lasts for 2 weeks or maybe lasts for months, but they have some kind of issues going on. And that's why we need more therapists, more psychologists helping them all over the world.
There was a study conducted in NIMH, and they said that it requires on an average 10 years for someone who's suffering from a mental disorder to, first come to a therapist or a psychiatrist. So it's still like very stigmatized. And in Bangladesh, the study says that people who are suffering from mental health disorders, 92% still don't come to the psychiatrist or therapist. Why do you think people think that coming to a therapy is a bit, fancy, like it's costly, it takes 12 to 16 sessions. Like, what do you say to your client when, she comes to the session in the first, in the first session, like she might say, I want to finish it today, say whatever you can. And that cognitive restructuring takes a bit of time. So but your client is not educated. Yeah, she's not aware, but she wants to, be mentally fit. So how do you convince your client?
Okay. So I think most of the people, they want to be done in few sessions. It's because they think it's a very lengthy process. They don't want to give it that much time. And also the expenses, the more the sessions, the more like their expenses will increase. And also because like they want a quick remedy, like, a quick cure to all their pain. They don't want to like put effort and all like for that long. So what I suggest them is like, you have to be patient. As I said, that cognitive restructuring takes a lot of time. And to heal from any kind of trauma, it also takes time. Like, even if we give you medicines just to like, maybe the symptoms, like most of the time, like, the psychiatrists, they don't prefer giving that much medicines, but they give it when they prescribe the medicines when they need to, unless like when it's absolutely necessary, or else like, most of them, they avoid prescribing it. So what happens is like they come and ask for medicines most of the time because they think that medicines will make them like recover very soon, but that's not how it works. So when you take the medicines, your symptoms like, might improve a little bit. Maybe you are not panicking all the time, or maybe you are like, you can relax a little bit, but your trauma is still inside. What's bothering you, your pain is still inside. So like every time you're gonna go in this situation, you're gonna get triggered. The anxiety is gonna come back. So that's why like it even if it takes time, even if it takes like 13 sessions or 50 sessions, it doesn't matter. Just heal from the traumas, or else you're gonna be dependent on those medicines. You cannot take those medicines your whole life.
Definitely. And another point to add is, suppose someone just has anger issues, right? She's like very angry, very like sensitive towards rejection and everything. So anger can just kill your life, your relations will be hampered, and you won't have close friends. Your kids will be afraid of you. You will have promotional issues and stuff. So anger is not a mental health disorder, I would say, but it's something that's related to psychology and our inside self. So if we just keep our anger issues, like persistent in our lives, we're going to suffer a lot. But coming to the therapy, I think just talking for 4 to 5 sessions or maximum 7 to 8 sessions will like surely heal your anger issues, and that might result in tremendous benefit, through all spheres of life. So sometimes we don't understand the economic benefit of just simply working on your anger issues.
Exactly.
Similarly, it goes with improving your relationships, because if your relationships are good, you can't always like financially value it, right? So we go to coffee shops which are expensive. We buy sometimes, branded good clothes because we value it. We see value in it, right? But we sometimes don't see the value in therapy sessions. So I always request people, like, as a psychiatrist, I understand that you might be skeptic with medicines. There are side effects, definitely. We don't try to give medicines
unless it's completely necessary.
Exactly, or in severe cases, or if we give it, it's for very temporary period of time. But I always tell clients or people or everyone to have at least 4 to 6 sessions of therapy, in your life, in any time of your life, because it's not gonna, be anything harmful for you.
Yes.
It has no side effects.
Yes.
At least a few things you'll discover from the therapy sessions, your thinking patterns, your past trauma. Just truthful speaking will help you a lot. When I see, porn addicted patients, I always, tell them that just telling me about your addiction will heal at least 20 to 30% of your trauma, because they are so suffering from guilt inside. Just someone, listening to them about their addiction, it gives them so, soothing feeling in the first session. They get relaxed, like, and I was searching for someone. I wasn't able to tell my parents. I don't have, friends to tell about this. So it's very important to just ventilate.
Exactly.
And
sometimes I feel like it's it's easier to talk to someone you are not emotionally attached to, than talking to your friends and family, because you don't want to stress them out. You don't want to burden them with your pain. So that's why sometimes we don't say them, because they're gonna worry what they're gonna think. What their relationship with me might get spoiled. So it's better to talk with a mental health professional who can actually help you, because your friends and family, obviously they will give you that emotional support, if they will be there for you, but they cannot help you to change those patterns, those thought patterns.
And they can become sad, listening to your trauma. They can feel guilt.
Yeah.
Like your mom can feel guilt. She might start thinking that eta to amar jonnoi hoise, right? So a few clients also ask me this. So I'm asking you this question, the same question, that should I ventilate my trauma or anything to my friends? So I have a lot of issues and I don't want to go to a therapist, or my parents won't allow it, but I have 2 or 3 good friends. So are friends good as a therapist, or are friends a replacement of a therapist?
Friends, they're okay. They can be a good listener. As I said, they can cheer you up. They can help you to cheer you up. They can, listen to you. If they're a good friend, okay, fine, they will listen to you. But they cannot be replaced as therapists, because they haven't studied. They don't know, why you are thinking like this. Okay, they will, understand. They will be sympathetic to your situation, okay. But why this is happening? Or they will not do psychoanalysis on you, and they will not help you to teach the techniques. For example, like you said, someone with anger management, right? So they can go and tell someone that, their friend, I did this, I did that, I got really angry last night and I did this. And the friend might comfort them, okay, it's fine, just whatever happened, okay, you are not a bad person. And they can cheer them up and all. But at the end of the day, he still has anger issues. That's not changing, right? So that's why you need to come and seek therapy, because over here what we do is we talk to you and we understand what's triggering you. Why are you getting angry? What's your trigger points or stressors? Maybe it's connected to your childhood. Maybe it's connected to your present circumstances. So we help you to identify them, that maybe this is why you're acting like this, and you're projecting that anger on this. That has nothing to do with like, the present situation.
And friends sometimes are not active listeners. They
Yes.
give suggestions too early
Based on their experiences.
based on their experience,
Yeah.
and they're not really sometimes educated on mental, and then and they will say things like, oh acha acha buchhi tor kotha buchhi ekhon tuই amar kotha shon. They say phrases like this. So that's a problem. But if you have good friends, you can try. Definitely, we don't discourage that.
But then the techniques, like, suppose like to manage your anxiety, to manage your anger, like you need to learn some techniques, mindfulness and everything. So unless like you come to a professional, they won't be able to help you. And whether you actually have a disorder, you can only get to know when you come to a mental health professional. You get the diagnosis, and then like, okay, I'm suffering from a disorder. I need to like, work on it. The friends, they won't be able to give you that diagnosis.
Right. What are your advices, for parents who don't want to understand the mental issues of their, children? Like their children might be suffering from ADHD, which is very common, or OCD, or clinical depression, or any other disorders, which are, very common, but they won't understand it. They label it as laziness or any kind of weakness, or we're doing a lot of things for you, so why are you going to be, sad, and, phrases like this. So what would be your suggestion to parents?
Okay. So what happens is like during our parents' time, people they need to promote mental health like that. So there are a lot of terms like ADHD, they don't understand. There are a lot of like, symptoms that they just, dismiss it as like, okay, she's just lazy, or she's just like, being a spoiled brat, or she's just like, being a rebel without a cause. If I just like give her restriction, or if I just like ask her to pray, or if I just don't let her do this, she will be okay. So that's not actually how it works, because sometimes like, even you see a person, you see like, okay, fine, like maybe they're going out with their friends, and they're like, spending a lot of time, in front of the laptop, and you just blame them. Okay, fine, she's just like, not being attentive and all. So I would say like, to those parents, that if you think that your child has changed in the last few months, the attitude has changed, maybe she or he gets irritated really fast and getting a little bit isolated, keeps the door locked most of the time, spends most of the time on the laptop, and the academic performance also declining, and health issues are also causing. So I would advise them that like, try to talk to them and be open. The main reason why children, they don't feel comfortable talking with their parents is because whenever they share something, the parents blame them. Okay, you did this, that's why this happened. Okay, or they dismiss it. They dismiss their pain, like, okay, do this, then you'll be fine. No, this is nothing, that is nothing, you are just being like this sad for nothing. So then they feel like, they feel like, okay, I'm not gonna share because they won't understand me. They will put the blame on me. So, or they will judge me that I have done this, that's why. So they would rather go to their friends, not their parents. But you should come to your parents, because your parents are the only people who can help you to get the therapy, to get you what you need, not your friends.
Or give the proper
information, proper treatment. Because they care about you most in the whole world. So what I would suggest them, that like, be like a friend, like a friendly approach, and make them feel comfortable, so that there's not going to be any judgment. You can share it with me. And also like, educate yourself as well on these terms. Like, there are so many podcasts, there are so many articles, there's so many YouTube videos where people are being more vocal about mental health disorders like depression, ADHD, bipolar disorder. So get to know a little bit and see whether your child has this kind of symptoms for over 2-3 weeks or not, and then like, encourage them to come for therapy.
Right. Parents in, this subcontinent, especially in Bangladesh, they have a few problems. They really do have a few problems. So number one is they like they always compare. They always compare yourself, your, studies, your results with, your cousins or brothers or friends. That's a problem. And the second problem is they try to own you sometimes, when you're approaching 13, 14, any teenager will, try to establish a different identity. They still, love their parents. It's not like I want an identity because I hate my parents.
But also there is a generation gap.
There's a generation gap.
That's why.
So, they want a separate identity. They want a bit of space, a bit of freedom, and parents don't take it very positively. So they need to, balance these things. Like, okay, I'm gonna monitor their activities, and there will be discipline inside the house, but still my teenage kid also needs a bit of space because he is a separate identity. I don't own my child. So parents should be careful about that. And regarding teenagers, what I tell them is, you will need your parents in life, no matter how abusive or toxic they are. Apart from, I would say a few parents are very abusive and toxic, I know that, but they are sometimes helpful, when you're like sad, or when you have any physical health issues or anything, like they are blessings sometimes. So sometimes it's just helpful for us to ignore a few things and to look at the bigger picture. And
I would ask you something. So if a client comes with her family, and after talking to the family, you understand that there are a lot of toxicity in their thinking, the way they think, the way they live, and their relationship with each other. It's like there are a lot of dysfunctional families, right? So you understand, there are a lot of things that they're doing it in a way that that might not be acceptable for children nowadays, because so many differences in thought processes. So how are you going to deal with it? If the family she came with, the problem is with the parents, and the teenager, she's just giving the reaction to that problem. So how would you deal with that? How would you explain it to the family?
At first, I would like to hear the full story. At first, from the teenager, I want to tell him or her that I'm on your side, because you are having symptoms of sadness or depression, whatever. So I'm on your side, because the initial thought process of the teenager is like, my parents, brought me to this doctor, so the doctor will listen to my parents. So I try to tell them about this, like, I'm on your side. So whatever you tell me, I won't tell it back to you, to your parents, because the trust is very important. Because if the teenager doesn't trust me, he's never going to open up, right? So I ensure that he or she opens up. Definitely not in front of his parents. So I sit with him or her alone. Then I listen to the parents, only to understand if the teenager is, deceiving or hiding anything that I need to know. Because a lot of teenagers, or a lot of human beings simply lie, right?
Yeah,
and
they say just one side of the story.
Yeah. Some say lies, and some say things out of their faulty perception, right? Like, they think their parents hate them, but they don't actually hate them, but they are doing something which is making them think that they hate them. So faulty perception, and if someone is saying truth, is very important for a psychologist or psychiatrist to understand, because you can't always trust 100% of your patients or clients' words. They just might lie. You might have antisocial personality disorder cases. You might have narcissist people coming to you. You might have simple people who are not suffering from any disorders, but they're just simply lying or hiding facts, right? So we as therapists or psychiatrists need to understand people, understand who is speaking the truth, who is not speaking the truth. So we bring the parents, we talk to them separately, and I try to understand the complete picture. I try to solve the puzzle, the gaps in the story. And then when I've understood everything, I try to empower both of them. I don't take only the client side or the parent side. We all are imperfect. We all can improve, right? So I definitely try to be more empathetic towards the teenager, because he's a little guy. But at first, I want to listen to him, or I send him to a therapist like you, and they listen to him or her for 2 to 3 or 4 sessions, and they, then they build trust, and they open up a lot. And I work with the parents. I try to make them understand about the generation gap. In Bangladesh, there are, a lot of things that parents impose,
Yes.
culturally, religiously, a lot of things. So I try to make them understand that, okay, you might have your choices, but your teenage son might have different choices.
Sometimes they also try to control and like no one likes to feel being controlled, so that might also make them feel like very invalidated, overwhelmed.
Right. And sometimes just giving a suggestion very inappropriately hurts that child. Like I might definitely, a 16-year-old boy or girl doesn't understand life like his parents. Definitely, we all understand that.
And parents, they just want to protect their children. They think like we are controlling, or we are like suggesting this
we're
because
doing good for you,
for the good, because they know that the world can be a very scary place, and they just want to protect them so that they don't do anything wrong.
They have anxiety themselves, or they're a bit paranoid themselves, and then they transfer that paranoia, the anxiety towards that child. So I sometimes just try to treat the parents like I maybe the mom is suffering from clinical depression, so she remains irritated every time. So I need to heal the depression of the mother or the father, or they might have relationship issues. Then I need to send them to a relationship therapist. They correct their issues, and then it brings the family to more harmony. So the issues solve very, very quickly if we work with the total family. And in psychiatric cases, I think we should always treat a family, even if it's for a schizophrenia patient or a bipolar patient, because having a mental health disordered patient in your family, it hampers the whole family, and everyone needs to be on the same page.
Yes. So how do you convince the other parent to come to the family therapy? Because a client might come alone or with maybe his or her mother, but maybe the father doesn't want to come, but the father might be the issue. So how do you convince him through them to come to the therapy?
Well, that's a very tricky question. Sometimes I just can't, to be very honest. So I tell the person in front of me, okay, we know that he's not going to come. So let's try to focus on things that we can control, to cope or to, ignore a few things. Or might be they have wrong perception too, or they're just exaggerating things, catastrophizing. So I try to work on that, on his or her own life purposes, values, education and stuff, because your husband is not the only thing in your life. You have friends, you might have a career, you might have parents, you might have a lot of other things, hobbies. So why are you only focusing on your husband? He's not going to change, right? So I work on those things. But in a lot of cases, they do come. So what I do is I write in the prescription that, your wife has some issues. So, I need to understand her better through your words. So, I'm empowering the husband, and he thinks, okay, I'm going to come.
Now I can come.
I can vent to that doctor, and I'm going to,
tell all my problems.
Not my problems.
Complaining.
Complaints. And then when the husband or wife comes, so when they start talking, we are, mental health professionals. You will also understand that we understand that if he has any personality issues, you can understand a narcissist just by, observing them, and any kind of personality, borderline, histrionic. So then it becomes a bit easy. And we then initially try to, boost in their ego a bit, right? So when they start liking me or appreciating me, then I try to say, okay, brother, your wife has, 4 problems. Like we're working on that. You have this, and why not we also try to correct this? So you have to empower his or her ego. You can't say that, you guys have 50-50 problems. that's game over. So you have to say that she has 75% of the problems and you have at least 25. So let's work on those, and then things become a bit settled. But it's tough. It's very tough. And that's why, in therapy sessions, we sometimes have a few bad reviews, because even trying to help people sometimes results in a chaos. Suppose a family comes where the husband is very abusive, very physically abusive. And, after doing 2 to 3 sessions, you understand that this relationship is not something that the girl should be in. And you very politely, suggest her after talking to their parents and assessing the overall circumstances. But you're doing something good, right? But that, girl or woman, whatever you call her, she goes home And she says to her husband that,
My therapist told me.
brother Kushal said that I need to get divorced and you're a bad human. I didn't say that. But I told her in a very soft tone. But due to her, depression and anger and everything, she, says it in a language or in a tone.
Or maybe she just wanted to say it like even my therapist says that, like, you're a bad person and I should not be with you.
Absolutely. And then, the husband comes with an ex and, he's going to kill me. So it's sometimes very difficult as a psychiatrist or therapist to work inside your chamber. It's very stressful also. People sometimes behave very, I would say, inappropriately. But we know that. And we know that at least 10 to 20% cases, we will experience this as some of our clients commit suicide. We feel bad. We know that we can save everyone, but we can help like a lot of people still. So, that's what keeps the cycle going.
So a lot of teenagers, like the time when they reach puberty, so what happens is like they become maybe cranky or they have mood swings. And as we know that there are different kinds of depression. There is major depressive disorder, then there is depression due to medical conditions, and there's another kind of depression as well, which is like premenstrual dysphoric disorder. And a lot of people, maybe they are not aware of it and they think that maybe it's just PMS, like how like you have low mood and you have low energy a few days before your period. But in some cases it's severe, and research has shown that like whenever something traumatic happens to you, like that disorder gets activated. You are more vulnerable, you are more angry, you are more moody, and you scream and you feel more frustrated. You get more intrusive thoughts during those time. So how do you think it can be treated, like by medicines or by therapy? Like how girls and women, even young adults, they can like manage it or cope during those times when they're feeling like very hopeless?
Well, PMDD is very different from PMS. Yes. So PMS is basically premenstrual symptoms, right? So PMS happens on an average of 5 to 8%. Sorry, PMS happens almost to 80% women, right? It's very common. It's like mild to moderate mood swings. You just remain a bit moody, before the week of your, menstruation. It's very common, right? But PMDD is a clinical disorder. In 2013, it was first introduced in DSM-5, the third edition. It was previously in the appendix, labeled as other conditions. So it came to limelight in 2013. So PMDD is a severe form of PMS. It's dreadful. It's very, very tough, and 5 to 8% of women suffer from PMDD. So there are emotional symptoms and there are also, physical symptoms. So
how can they differentiate between PMS and PMDD?
So it's like very drastic. It's like it's like they become like a wonder wolf, So it's very angry, very sensitive towards rejection, very anxious, loss of focus, overeating. You might have physical symptoms also like joint pain, muscle pain, breast swelling or breast tenderness. You might be sleeping too much. It's very difficult at that time to get along with people, always cranky, severe mood swings. It's very, very drastic.
But is there any way to diagnose? Like
there are 11 symptoms according to DSM-5, and among the symptoms that I've mentioned, I don't remember every symptom because it's tough, but the drastic nature of it will tell you that she is suffering from PMDD. If you have 5 or more of the symptoms that I told among the 11, you're going to have PMDD. It's not that in every menstrual cycle you need to have it, but most of the cycles you'll have it. And there are very good treatment options for PMDD. And the first thing we need to understand is not to judge these, girls or women, because they are not making it up. Like we sometimes just label women as, oh, okay, why are you so angry? You're always so angry. So we shouldn't do that because PMDD is very tough for women, and it can be associated with a lot of pain also, menstrual pain. So a few SSRIs work tremendously because PMDD mainly happens due to a drop of progesterone during the mid-cycle. So when there's low progesterone, the progesterone gets converted into another hormone. So that acts on, GABA A receptor. So the GABA A receptor is basically the receptors that, benzodiazepines or alcohol, bonds with. So what happens when we withdraw from benzodiazepine or alcohol is the same thing that happens in PMDD, because progesterone drops, that hormone drops, and there's lesser GABA A binding, so there's intense withdrawal like symptoms. So that causes that emotional imbalance. So it's very common. So SSRIs help a lot. You can have intermittent dosing, like you can start just 1 week before the menstruation and continue for 2 weeks and stop it, or you can continuously take a few SSRIs, particularly sertraline and fluoxetine are very, also paroxetine is very helpful in treating PMDD. Also, you can go for hormonal therapies, and for that, definitely a gynecologist should be consulted. You can try simply changing your diet, like eliminating caffeine, sugar, nicotine, and alcohol. Also, a few, I would say, dietary exercise helps. Sleeping also helps for 7 to 8 hours. Particularly, a few nutrients are also found to be helpful in PMDD. Like if you take more than 100 milligram of calcium daily, it helps. Vitamin D 400 milligram daily also is helpful, and also zinc helps to reduce the symptoms of PMDD. But what I would like to say about PMDD is, don't judge these women. It's really painful. It only affects 5 to 8% women, and it's treatable. Similarly, I would also like to say to everyone that not every anger issue is due to PMS and PMDD. Sometimes we just might have anger issues which exacerbates during our menstrual time. So if that is the case, you need to treat the PMDD also, and also your anger issues. Or if you have anger issues with PMS, then you just need to work on the anger issues, because PMS is not a disorder. Like it's a very common symptom that everyone experiences.
But someone who has depression already, how likely it is for her to develop PMDD?
Very high, because a few women just have clinical depression with PMS exacerbations. So at that time during the menstrual cycle, especially before it starts, the previous week, the depression gets very, very worse, like severe suicidal feelings, and you just don't want to do anything. Yes. So she already has clinical depression alongside the PMS that exacerbates the clinical depression.
Okay. So since we have talked about depression, like, among teenagers, and then we have also talked about the causes, like why there might be high rate of depression nowadays among them. We also talk about depression among adults, among marriage and all. So what would you suggest them, like how they can cope and how they can manage the symptoms and how they can live more fulfilling life?
I always tell to do 4 things to a person who is suffering from clinical depression. The first thing is, we should try to work with any kind of external stressors that we have. So we might be having a relationship problem, we might be having financial issues, or anything that's in our external world. We need to solve that problem, because a lot of us don't try to solve problems. We just sit at home thinking that time will heal everything. But time, doesn't heal anything. Time only gives us
makes
time,
us used to that pain.
Or time only gives you time to heal things for yourself, right? So you need to solve that problem. And if you can solve your problem, seek help from a friend or therapist who will help you solve that problem. So that's number 1. The second thing I would say to them is to work on your traits, your inflexible thinking, your inflexible, personality attributes. You might be, you might have anger issues. You might be sensitive to rejection. You might be an inhibitory perfectionist. You might even not know about these things. So coming to a therapist will allow yourself to know about your traits, and you need to work on those if you want to come out from depression. So that's number 2. Number 3 is to correct your lifestyles as much as possible. None of our lifestyles is perfect, but we need to, at least improve our lifestyles. Better eating, better exercising, having healthy habits, and everything, and sleeping well, definitely. So that's number 3. And number 4 is, I would say, if these 3 things don't work for you, definitely go for evidence-based scientific therapy, or try a bit of medications, because research findings says that if you combine these 2 things, the best results are, achieved. So don't get shy, or don't think you're weak. Don't think like, why should I need medicines or therapy? Like, you don't think like that when you broke your arm, right? Or when you have a swollen leg, you go to the orthopedic surgeon and he does some wonders for you. So why are you thinking differently when you have clinical depression? Because that's also a medical condition and you need to treat that. So if you have a sprained leg, you can see it. The only difference with depression is you can see the pain. So you might be smiling and you might be very active, but you know the pain yourself. So you need to leave your pride behind and seek scientific evidence-based therapy. So these are the 4 things I would like to say to anyone who will be who is suffering from clinical depression.
So since you have dealt with a lot of cases, with teenagers, so what would you suggest them? Like, what tips they should keep in their mind to live a more better life and to cope well?
Okay. So I'd like to say mainly 3 things to teenagers and also to grown-ups, but especially to teenagers. The first thing is, be grateful regardless in life. Just be grateful, because gratefulness is like pivotal to having a good mental health. We all go through a lot of sufferings in life, but whatever we focus grows. So if you're focusing on the negative things of life, we all have negative things, but it will grow and only grow and make your life miserable and toxic. But if you like focus on the good things that happen to you, or the things that you should be grateful for, so that will grow. So you might have a bad dad, okay, toxic dad, but you have a loving mom. So focus on your mom. I know it's tough, but still focus on the positivity, the things that you have. So be grateful regardless. That's number 1. It will definitely help you. Number 2 is always try to make things better than worse. So you need to understand that we all can improve as a human being. Like if I'm sleeping at 1 a.m., I can sleep at 11 p.m., right? I can make my life better. If I'm eating unhealthy, I can eat healthy. If I'm into a bit of drugs, I can, quit from it. So even though we're suffering from a lot of things, we all do, tomorrow or today, but we can still make our life better than worse by being proactive and not reactive. So we should have that mindset. And number 3 is I would request all teenagers to always have, that anxiety that am I deceiving myself as a human being? That am I lying? Am I dishonest? Am I doing things that I should not do as a human being? Am I cruel to animals? Am I cruel to women? Am I cruel to my family, teachers, friends, and everyone? So you should have that positive anxiety that am I deceiving myself and this world? This anxiety is helpful. It's not harmful, because we all should have that, self accountability. Are we contributing to this world? Like every single good thing that we do tilts the world slightly towards good rather than evil. And every single evil thing that we do tilts the world slightly towards, evil rather than good. So our works matter, our decisions matters, our life choices matter a lot. So this is the 3 things that I would like to, say to teenagers. So thank you, Afifa. Yeah, it was lovely talking to you. And I hope that you become a very impactful psychologist. And it's good to have you here in LifeSpring.
Thank you so much.